Hey, what's up you guys? Welcome to my channel. I hope this video finds you well. Today we're going to be discussing all things surgery. So I just finished my 5th rotation as a PA student in surgery. It was a rural location in Kentucky. My first 4 rotations I was in, psych, family medicine, internal medicine, and geriatrics. So this was my 5th rotation. I had a lot of fun on those other rotations, but this one by far has been the most fun I've had. It was an incredible experience. So we're gonna hit the highlights of it. I'm gonna get to your questions that you asked me on Instagram. We're gonna have a good time, so stay tuned. So our first question here comes from Robbie Tensley 22. He asks, what were the hours like? So with this being a surgical rotation, I was a little nervous about being on call, working weekends. Much to my surprise, I had none of that. Monday through Friday, 7 a.m. to 5 p.m. or so. It was actually really nice. I enjoyed that part of it. I know I got super lucky there. But in the mornings, we were at the hospital, we were in surgery doing cases, and then by noon or 1, we would be back in his clinic seeing patients and follow up, scheduling new surgeries. So that's pretty much how it went. It was surgery cases, pretty much 7 a.m. to noon, and then 1 p.m. to 5 p.m. we were seeing patients in his clinic. So it was pretty neat to have an OR setting and an outpatient clinic setting all in the same time. All right, Chad asks, how were the surgeons you worked with? Were there any jerks? So my preceptor was a general surgeon, and he was extremely nice. All of his colleagues that worked with him were also extremely nice. I really didn't run into any real jerks on the rotation, which was kind of surprising. You kind of expect surgeons to be these really confident, kind of narcissistic people, but everyone that I ran into was extremely nice, and I think that helped with the rotation. It definitely helped me with my confidence. My surgeon was actually pretty funny in surgery. He would always crack jokes. He'd be messing with the surgical techs. So if you're familiar with surgery, you know that nurses have like their tray of sterilized equipment, and it's next to the bedside of the patient, and there'd be some days where my surgeon would just walk up and mess up all the equipment that was sitting on there. It was all nice and organized, and he'd ruffle it up, and the nurses definitely loved that. But that's kind of how he was. He was laid back, and that's really how a lot of the surgeons were that we worked with. BH Moorhead asks, how involved is a surgical PA in an actual procedure or surgery? So that's a really good question, and I don't know if I can exactly answer that. Just being a student, but I would say it's totally up to the individual surgeon that they're with. I would say that their comfort level, the relationship, the more time you spend in surgery, the more experience you're going to get, the more your surgeon is going to trust you. So I would say that some surgeons would probably allow PAs to do much more of the procedure, whereas others would just allow them to maybe close or maybe even open. But for me, on this rotation, I helped close on every case, so I was putting the stitches in at the very end, but I still had a lot of fun doing it. Alyssa Horton asks, is it intimidating, hard to adjust in surgery? Kind of like how I alluded to earlier, that everyone was pretty laid back and nice. It wasn't necessarily hard for me to adjust, and that really helped, and that really helped boost my confidence too. So no, it wasn't hard. It will depend on the surgeon that you're with. If they are very uptight, very, what's the word I want to use? Just kind of like control freaks, and make you just those people that are just, you're just nervous to be around them. Then I think it would have been much more intimidating, but everyone from, like I said, the scrub techs through the surgeons, everyone was really nice, and you could tell that it was a learning environment, so I appreciated that. Rena Simonson asks, were you afraid you would be sick or pass out the first surgery you went into? Also, how is the PA physician dynamic in the OR? So I had shadowed before in surgery, so I wasn't nervous about passing out or seeing blood or anything like that. Luckily, never felt lightheaded or anything like that, so that's good. And how is the PA physician dynamic in the OR? Again, just being a student, only being there for 4 weeks, it's hard for me to kind of assess what it's like in the real world when you're a certified physician assistant working alongside a surgeon. But I will say that the surgeries that I've shadowed, The dynamic is really good. It's pretty flawless when you see a PA who's first assisting their surgeon. They know when to retract, they know when to sew. They can almost do the surgery without speaking, as far as my experience goes and what I've seen. So I would say that the PA physician dynamic is really good in the operating room. AAR Bear 21 asks, what specifically appeals to you about the OR? That's a good question, and I've kind of wondered myself what it is I exactly liked about the operating room. And I think it's just the laid back environment. It's that, and it's just the fact that you can have a human being sitting in front of you and pretty much cut them wide open and be working through all the intricacies of the human body. And just, I don't know, it's pretty mind-blowing how surgery works, how fast people recover, how you can remove organs and they're better the next day. Heck, a lot of our surgeries were outpatient, so we'd fix a hernia and 4 hours later the person would be leaving. So I think it's a combination of those things. I don't have an exact answer for you, other than it was just fascinating to me. Lastly, Bellarkfeld asks, what surgeries did you see during this rotation and how long were you in the OR each day? So my surgeon was a general surgeon, so we did a lot of hernia repairs, whether that be inguinal, epigastric, like the ventral hernias or the incisional hernias that someone might get from a previous abdominal surgery. So repaired a lot of those. Did a lot of laparoscopic gallbladder removals. Let's see, we did a couple mastectomies. Going off the top of my head, I know I'm missing a few. We did a lot of colonoscopies, which is more so me just observing while my surgeon maneuvered the scope. EGDs, where they stick the tube down your throat. And as far as how many hours I spent in the operating room each day, it really just depended on the day and how many cases were scheduled. So like Monday, Tuesday, Wednesday, Friday, those were our surgery clinic days. So in the mornings we could spend 2 hours, we could spend 4 hours in surgery. We could work up all the way until we saw our first patient at 1 o'clock. It really just depended. And then Thursdays were the long days, where from 7 a.m. until 4 or 5 p.m. we'd be in surgery for the full day. So we'd probably do 6 or 7 cases on Thursdays. So that's the end of this video. I had a great time answering y'all's questions. If you have any more questions or any comments, drop them below. I'll answer them as soon as I can. In the meantime, I'm always on Instagram at daywiththepa. Give it a follow right here if you're not already. I try to post a few times a week at least. With rotations now, I've cut back some, but I try to stay active on there. But again, thank you for watching. I hope this was fun. I hope this was informative. Have a good day.